Okay. The topic is grades of mobilization and types of mobilization. We'll discuss types also. I think this topic is already covered. So few students they requested for a revision of this topic. So can you hear me?
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
So passive joint mobilization technique. Before giving passive joint mobilization, you have to check for the or you have to examine and evaluate. So three steps you have to follow. First is you have to examine the joint and thoroughly evaluate the joint. And second is you will assess the quality of pain. And third is you will check whether the patient is having any capsular restrictions or not. Clear? So these 3 points you will check it before practically applying the mobilization. First is, again I'll repeat 3 points: examination and evaluation of the joint to be mobilized, quality of pain, and third is capsular restriction, whether the patient is having, the joint is having capsular restrictions or not. These three things you will assess. First is examination and evaluation. What does it mean? So if the patient has limited or painful range of motion, if the patient is having limited or painful range of motion, examine and decide which tissues are limiting. Clear? What is the reason for the limited range of motion or limited function of the joint? And what is the state of pathology? This first you should identify. Clear? Why? Because in order to select proper mobilization technique, first you should evaluate the joint. Clear? So that accordingly the treatment can be given. Second is, what is the purpose of giving joint mobilization? Why the mobilization should be given? Determine whether treatment should be directed primarily towards relieving pain or stretching the capsule or stretching the joint or the joint soft tissue, that is capsule. Here. So if you take any patient, if you see the limited range of motion is because of two reasons. Limited range of motion may be due to two reasons. One is either patient may have pain or the patient may have tight capsule or the accessory movement are restricted. Accessory movements are limited. So this is the two main reasons for limited range of motion. So if the patient is having pain, he will not move the joint. If the patient is having less accessory movements due to tight capsule, then also the range of motion will be limited. So first you have to determine, first you have to check what is the reason for the limited range of motion. Clear? So that you have to evaluate in the beginning. That is before proceeding with the mobilization. Second, you will check the quality of pain. Pain is very detailed. Explanation is required. I will explain in brief about the quality of pain. Exactly where the patient at particularly which range of motion the patient is having pain. If patient, again I'll repeat, first you will evaluate and you will determine what is the reason for limited range of motion. This is first slide. Patient, if the patient is having pain, if the patient is having pain, and because of pain, if the range of motion is limited, listen carefully. If the patient is having pain in the joint, and because of pain, the joint range of motion is limited, Next step is you have to find what is the quality of pain. If patient is having pain, then next evaluation is you will check the quality of pain. Clear? The quality of pain when testing the range of motion, that is when you are performing the range of motion, the quality of pain will determine the stage of recovery and the dosage of technique. Clear? For example, if the patient is having what is tissue limitation, here in the first point I had explained pain before tissue limitation. So what does it exactly mean? Tissue limitation is, suppose if the patient is having abduction range of, normal full range of motion is 180 degree. 180 degree is the shoulder abduction. You know the normal range of motion. Clear? If suppose patient is having 90-degree range of motion is limited and it is 90 degree. Clear? So this limitation of range of motion from here to here, this is available range of motion. If the patient is having only 90-degree range of motion, I have told there may be two reasons. One is because of pain or because of tight structures. Capsule, if it is tight, then also it will restrict the range of motion. That is available accessory motion is limited. So these are the two reasons. So this 90-degree is called as tissue limitation. Clear? This 90-degree is called as tissue limitation. Suppose if the patient is having pain, in this range, clear? Pain before tissue limitation. What is tissue limitation? Here it is 90-degree. If the patient is having pain before, the patient may have pain before 90-degree or that is less than 90-degree range of motion, or pain with tissue limitation. What does it mean? Pain at 90-degree. And what is C? Pain after tissue limitation. After 90-degree. That is after 90-degree. Clear? The patient may have pain. You have to assess the quality of pain. First, I have told you will determine what is the reason for limitation of range of motion. In the first slide, we discussed what is the reason for limitation of range of motion. If pain is the reason, then you will assess the quality of pain. Then you will check where the exactly pain is. That is before resistance or before tissue limitation, with tissue limitation or after tissue limitation. So what is the necessary of assessing this quality of pain? Because the dosage techniques and or the dosage technique, it depends on the specific condition. Clear? You should know the appropriate which technique you will select. For that we will discuss in practical lectures. In order to identify the dosage of technique, you will assess the quality of pain. Are you clear? Anyone, yes or no?
Yes, sir. Yes,
So you
sir.
will, in order to select the appropriate dosage, in the mobilization there are so many grades, different grades. So you should know which grade you will apply. Selection of dosage, selection of grade. In order to select appropriate dosage, you have to assess the quality of pain. So this is second point. First point is you will evaluate and examine, and second you will assess the quality of pain, and third you will check the capsular restriction. Clear? Capsular restriction. Already we discussed range of motion. Range of motion will be restricted because of two major reasons. One is because of pain, that is just now we discussed, and second is because of capsular restriction. So these are the two major reasons. Increased pain and increased capsular restriction will decrease the range of motion. So this we have discussed. Now we will study the capsular restriction. The passive range of motion for that joint, that is the specific joint, is limited in the capsular pattern. That is, mobilization will be helpful. Again, I'll repeat. Mobilization will be useful, or it will be appropriate in increasing the range of motion. Clear? In increasing range of motion when the restriction is due to capsule. I think you understand this sentence. If the joint range of motion is restricted because of capsular pattern, if the range of motion is limited because of capsular pattern of restriction, then mobilization will help a lot. That is, if you give mobilization, range of motion will increase. Or I will say in other words, if you give mobilization, if you give joint mobilization technique, it will increase range of motion if the range is limited due to capsular pattern. Once you read this sentence, that is, if the joint mobilization will increase the range of motion if the range of motion is restricted due to capsular pattern. So first, what is capsular pattern? Have you heard this word, capsular pattern of restriction? So each and every joint, it has a different pattern of restriction, capsular pattern of restriction. Again, we will have separate lecture on that in capsular pattern of restriction. If the range of motion restriction follows, if the range of motion restriction follows the capsular pattern, then mobilization will increase the range of motion. Clear? So each and every joint, it has a capsular pattern is different. Clear? So before proceeding with the mobilization, you should know the pattern of each and every joint. You should know the capsular pattern of the joint. Clear? So there is a firm capsular end. So these are called capsular restriction. the joint should have firm capsular end feel. Again, end feel is a separate lecture. Clear? There is a firm capsular end feel when overpressure is applied to the tissue limiting range. That is, end feel should be capsular, firm capsular. There are different end fields are there. The end field should be firm capsular. Clear? And third point, there is a decreased joint play. What is joint play? Accessory movements are called as joint play. That is rolling, spinning and gliding. They are called a joint play. So these joint play or these accessory movements is decreased. Clear? When you perform mobility test. When you perform mobility test, so we have studied 3 points in this slide. We have studied 3 points. So what are the 3 points? First is the range of motion restriction is due to the capsular pattern. Second, the end feel is firm capsular or the firm capsular end feel. And third point, there will be a decreased joint play when you test the mobility of the joint. So this is about the capsular restriction. Any doubt? 2 points we discussed. Quality of pain we discussed and capsular restriction we discussed. And third is grades or dosages of movement. So I have already told you what is the purpose of evaluating the joint? The purpose of evaluation is to select the appropriate dosage. Clear? What is the purpose of evaluation? The purpose of evaluation is to select the appropriate dosage or select the appropriate grades. Clear? So there are 2 techniques are there. One is graded oscillatory technique and second is sustained translatory joint play technique. There are 2 techniques are there. Clear? So all these grades you might have studied. All these grades you might have studied. I will first there are 2. First one is graded oscillatory technique. You might have seen this image. So this grading technique is given by Maitland. Okay, it's adapted from, this is called, otherwise called as a Maitland technique. Clear? So graded oscillation technique is otherwise called as Maitland technique. There are 4 grades are there. 4 grades are there. You should understand there are 3 vertical lines are there. 3 vertical lines. This is 1, 2 and 3. You should know what does this line represent. Anyone can answer the question? What is 1? Can you hear? Hello? Can you hear me?
Yes, sir.
What is 1? What is 1? What is 2?
Small amplitude rhythmic.
No, I am not asking grade. I am not asking grade. I am asking what is this line represent? This line, vertical line. What is this vertical line represent?
Range of most starting range of
beginning of
At 0 degree.
beginning of range of motion. Clear? And these three represent anatomical limit and two represent tissue resistance. So this you have to understand first. Okay. So for example, imagine this is 0 degree or neutral position. And what is full range of motion? Full range of motion is 180. Full range of motion is 180. Clear? So this 0 degree is called as 0 degree is called as or the first line. The first line represents this position and the third line represent this position. I think you are clear what I am saying. This is beginning of range. 0 degree is the beginning of range. And this line represent beginning of range. And this line represents anatomical limit. And this is beginning of range. Imagine a patient is having 90-degree range of motion. 90 degree. Imagine a patient is having 90 degree, or this limitation, it may be due to pain or it may be due to capsular restriction. Clear? So this, it represent the tissue resistance. Clear? So what is one? One is beginning of range of motion and two is anatomical limit. You know 180 degree is the anatomical limit, full range of motion. And what is third line? Third line is tissue resistance. This line represents tissue resistance. That is available range of motion. Or you can otherwise call it as available range of motion. Can you follow me?
Yes, sir.
Okay. So now I will take another example. Imagine a patient is having 40-degree range of motion. Imagine a patient is having, this is 40 degree. 40-degree range of motion. Now, the line number 3 will not remain in this position. Now, this line position will be shifted towards this direction because this represents 90 degree. 40 will be somewhere here. So, now the line 3 should be drawn somewhere here. This is the third line. Are you clear what I am saying?
Yes, sir.
This 1 will remain same, 2 will remain same, but this third line will move either this direction or this direction depending upon available range of motion. Depending upon the tissue resistance, this line may change. Last example, I'll give another example. Imagine a patient is having 120 range of motion, 120 degree range of motion. 120 will be somewhere here. This is 120-degree range of motion, available range of motion. So now, where the line will be closer to full range of motion. Closer to full range of motion. This is the line. So what I want to say is, this three line, this is line number 1, this is line number 2, this is line number 3. So this anatomical limit is fixed. If you take shoulder joint, it is 180 degree. If you take elbow joint, it is something different. It in shoulder joint it will be 180. If you take an elbow joint, it will be different. Maybe 140 or 160, 150. It varies. Clear? So this line is fixed, but range of motion may differ depending upon the joint. Clear? So here, coming to this diagram, you can take this as an any joint. We will take an example, shoulder joint. So here it is beginning of range of motion. Here it is end range of motion, or we have studied this as a line number 2. End range of motion, that is 180 degree, 0 degree. And now this third line, it's easy to identify. Clear? See, if the line is somewhere, this third line is somewhere here, it means 90 degree. Just for explanation I am giving, it's not fixed. For understanding purpose I am giving this degrees and all. Clear? If it is 90 degrees, then the line may be in center, but the line is not in the center, so which means it may be 100 or 120, something like that. The range may be 120 here. So a patient is coming like this. What is your treatment plan? What you will do? First you will, so these things you will decide. And I'm talking only about line. A patient is coming with range of motion 120 degree. A patient is coming to your clinic and you are evaluating the patient, and you found that the patient is having 120 degree range of motion. What is your treatment plan? A patient is coming with limited range of motion. A patient is coming with limited range of motion, that is 120 degree. What will be your first line of treatment? What you will do first? You will evaluate. What you will evaluate? You will evaluate what is the reason for limited range of motion. Why the range of motion is 120? It may be due to pain, or it may be due to capsular restriction. You have to first find what is the cause. Clear? And what will be your aim of treatment? Aim of treatment is to increase range of motion. This is your aim of the treatment. When the patient is having capsular restriction. Clear? If the patient is having pain, then what will be your aim? To reduce the pain. So these are the two aims. Clear? Are you clear what I am saying?
Yes, sir.
Pain is range of motion is reduced either due to pain or due to capsular restriction. Clear? If pain is the reason for limited range of motion, then what will be your treatment? What will be your treatment? Your treatment is to reduce pain. If capsule is the reason for range of motion, reduced range of motion, then what you will do? You will go for capsular stretching. So if you do these two things, automatically the pain will, sorry, the range of motion will increase. Clear? So ultimate aim is to increase the range of motion. Your aim, ultimate aim is to increase the range of motion. Or in this diagram, what is your aim? Your aim is to, listen carefully, your aim is to line, move the line 3 towards 2. That is your aim. What will happen if this line is moving towards this line? What does it mean? It means range of motion is increased. That is your aim. Clear? We already discussed in this example what we discussed. We discussed 120 patient is this patient is having 120 degree. And what is full range of motion? It is 180 degree. Here, patient is having 120. Your aim is to, what is your aim? We discussed here. Aim is to increase the range of motion. That is your aim. In this diagram, what is increased range of motion? Suppose if this line is not present here, if the line is, if you are drawing the line here, what does it mean? It means range of motion may be 170 degree. So you have increased 120 to 170 degrees. So this is your aim. Your aim is to move the tissue resistance line towards anatomical limit line. I think you are clear. Yes?
Yes, sir.
So it may be, already we discussed, what is the reason for this limited range of motion? What is the reason? I have told it may be due to pain or it may be due to capsular restriction. You have to find out why the range is reduced, because of pain or because of capsular restriction. Why? What is the use of finding it? Because the treatment dosage is different. If the range of motion is limited due to pain, then the dosage is different. If the range of motion is restricted due to capsular restriction, dosage is different. So how you will know which dosage you will apply? That is the purpose. You are identifying the cause of limited range of motion restriction. Okay, now coming to the grades. Grades already you know. Still I want to revise. What is grade 1? Small amplitude, rhythmic oscillation. Actually this is a practical topic. It's difficult for me to teach you the practical theoretically, but anyhow I will try to explain you. What is grade 1? This is treatment technique, treatment grades. This is the treatment grade. Grade 1, grade 2, grade 3 and grade 4 are the treatment grades. And what is, okay, what is this line? It is already mentioned. It is available joint play. What is available joint play? What is joint play? Joint play already we discussed. It is rolling, spinning and gliding. These are called as a joint play. Clear? Or if you want more specific, if range of motion is full, or in other words, range of motion is normal, what will be the available joint play? Now I am asking you question. I'll give three example. Second, or we will take example shoulder joint. Shoulder joint. First case, second case. First case is if range of motion is normal, that is what is normal? Normal is 180-degree. Shoulder abduction. Clear? 180-degree. Then, why the joint range? Why the range is full? Why the shoulder abduction is full range of motion? Or in other words, what is the why the joint is having full range of motion? Because joint play is maximum. Because joint play is normal, maximum or normal. Because joint play is normal, range of motion is normal. If joint play, that is, if rolling, spinning, and gliding is normal, listen carefully. If rolling, spinning, and gliding is normal, then range of motion will also be normal. If rolling, spinning, and gliding, that is available rolling, spinning, and gliding is normal, then range of motion will also be normal. Second point, if range of motion is 90-degree, that is limited range of motion. What does it mean? It means available joint play is limited. What is available joint play? That is rolling, spinning, and gliding is limited. That is why the range of motion is limited. Third point. So what you will do? What is your aim? I have already told the aim is to increase range of motion. So how you will increase? You have to increase the joint play. Clear? Because you know that the joint play is limited. That is why the range of motion is limited. If the joint play is increased, automatically the range of motion will also increase. Are you clear what I am saying?
Yes, sir.
So now coming to this image, if the patient is having full range of motion, if the patient is having full range of motion, then what does it mean? It means available joint play is also maximum. What will happen if the range of motion is restricted? So here the range of motion is range of motion, sorry, the range of motion is restricted 120 degree. Why? Because available range of motion is limited, or available joint play, sorry, available joint play is limited. So this much joint play is not available. So what is your aim? Your aim is to achieve or increase the joint play. If the joint play is increased here, if the joint play is increased, automatically the range of motion will also increase. So your ultimate aim is to increase the joint play. So that is why here it is mentioned available joint play. Okay, grade 1. So how you will increase the, first I will explain what is the grades. Grade 1 is small amplitude rhythmic oscillation performed at the beginning of range. Small amplitude rhythmic oscillation. When you see the vector, it is small. And you see it is very small. It is, that is why it is called as a small amplitude. Clear? And what is second point? Second is rhythmic oscillation. Rhythmic. Clear? Oscillation. Oscillation. That is why the arrow mark is given in both the direction. Clear? It represent oscillation. Clear? If you are drawing, if you are making a diagram in single direction, it does not, it is not oscillatory technique. It is sustained joint play technique. Always you have to mark on both the direction, arrow on both the directions, which means oscillation. Clear? It is small, small amplitude, and it is rhythmic oscillation performed at the beginning of range. So this already we know this is beginning of range, 0 degree. This is beginning of range. And second is, you see the amplitude is large amplitude, and both the direction, oscillatory technique. It's an oscillatory technique. Large amplitude rhythmic oscillation performed within the range, not reaching the limit. Large amplitude rhythmic oscillation performed within the range. So what is the range here in this patient? 120 is the range. We discussed 120 is the range for this particular patient. Large amplitude rhythmic oscillation performed so it is large amplitude rhythmic oscillation performed within the range. What is the range? We have taken example. We have taken example 120 degree. Within 120 degree range, not reaching the limit. What is the limit here? 120 is the limit. And you see, it has not reached the limit. And it is within the range. Within the range and not reaching the limit. Clear? That is the definition. Large amplitude, rhythmic oscillation performed within the range, not reaching the limit. Clear? This is grade 2. What is grade 3? large amplitude rhythmic oscillation performed up to the limit. Now you see it has reached the limit 120 up to the limit and stressed into the tissue resistance. You see it is slightly crossing the line. Right, you are crossing the limit. Slightly you are crossing the tissue resistance. Clear? Large amplitude rhythmic oscillation performed up to the limit of available motion, that is 120 degree, and stressed into the tissue resistance, that is you are crossing the line, you are stressed into the tissue resistance. And grade 4, small amplitude rhythmic oscillation performed, it is small amplitude. See the length of the arrow is very small, like here. It is small amplitude rhythmic oscillation performed where? It is performed at the limit. And what is the limit here? 120 degrees. So you are performing at the limit and stressed into the tissue resistance. That is you are crossing. You are crossing. So this is about grades. So grade 1 and grade 4 is small amplitude. The only difference is grade 1 is performed in the beginning of range and grade 4 is performed at the tissue resistance. And 3 and 4 is, sorry, 2 and 3 are large amplitude rhythmic oscillation, but the difference is one is not reaching the limit, other is reaching the limit. Any doubt?
No, sir.
So we have discussed today graded oscillatory technique. So there is one more technique, that is sustained joint play technique. This we will discuss next class. So today we discuss 3 points. One is examination evaluation, assessing the quality of pain and capsular pattern, and we have studied 2 grades. Among these 2 grades, one grades we have discussed all the 4 dose.